on to slide 2. Essentially, this relates to an overview of the decarbonisation of the health sector in Europe. The project is being conducted jointly by European Academies of Science and of Medicine. The location is therefore the EU. And particularly we're covering, as we've already heard this morning, the contribution of the health sector itself to greenhouse gas emissions. As Dave McConaughey mentioned earlier, the health sector itself can be seen as part of the problem in terms of contributing to greenhouse gases. It says here the stakeholders are involved, obviously, of the health sector itself, but very much the supply chains, but more broadly, the scientific community in Europe and policymakers. And that's the point that I will emphasise during the course of this short presentation. We published our commentary on the topic with our recommendations last month, and I'll come back to that at the end. But in terms of implementation, we will be following up during the course of this year and next year. Might just mention that under stakeholders, of course, we're all involved as patients or public using health systems. Okay, so next slide, please. Okay, so a lot of information on this. I'll go through it very briefly. Essentially, as academies, what we're building on work by many others, great work, for example, by Healthcare Without Harm in Europe, and also, as many of you know, the pioneering work of NHS England, which I'll cite in a little bit. Some of you heard that yesterday, and clearly there are other initiatives starting in other countries to decarbonise the health sector, and this was part of the messages we heard earlier about forthcoming up to COP26. Okay, so what are the academies doing? What can they do to add to all that? Partly to raise the visibility of some of the issues more widely, outside of the health sector, for example, to emphasise that setting out ambitious zero carbon targets doesn't just benefit climate change, it benefits health, it brings local co-benefits, for example, from greener hospitals, other models of healthcare, and so on. Also to emphasise that the hospitals and other parts of the health sector can do much for themselves, but it's also important to address the supply chains through sustainable procurement and so on. And I'll come back to that very briefly. But finally, the fifth point on this slide, that there is much that the health sector can do for itself, and NHS England is a good example of that. But we also need a supportive policy framework. And in the European Union, there are a number of current policy actions by the European Commission. Some of them are listed here, but it's not always appreciated that health is a critical part of these policy actions. So the work that the academies are doing is to engage with the European Commission and Parliament to raise the visibility of what the healthcare sector can do for itself, and to seek how policymakers can support that. Next slide, please. So just a couple of slides on the example. This is NHS England, showing the essentially carbon footprint, and you can see from the bit on the left that actually a lot of the carbon footprint is attributed to supply chains through medicines and so on. Actual operation of hospitals and travel is a lesser proportion of the total, but still significant. On the right, and I'm sure this is difficult to see, but essentially there's an analysis in terms of different parts of the healthcare sector, for example, acute care or primary care, according to their carbon footprints. Again, it's no surprise really, for example, in the acute care sector, a lot of energy used in the operation of buildings and services, whereas in primary care in the community, a lot of the carbon footprint is associated with delivery of medicines and other procedures. Okay, so next slide, please. Again, this is an example of the NHS, and it has been published this year, so I refer you to that for further detail. Progress is being made. However, if you look at the detail in this slide, I think it's reasonably clear that a lot of the progress has been in the delivery of care, much less progress in the supply chain carbon. And that clearly is a focus for continuing work. Okay, next slide, please. Okay, so what are we learning from this project? Well, I think we're learning that academies of science and medicine can help in supporting assessment, communicating, and helping to catalyse action, and I'll come back to that. We need to, as many of you of course know, we need to raise awareness of good practice within the health sector, in individual countries, individual facilities, and I know many of you here are involved with this, but we need to share these lessons across Europe and worldwide. I think we need to continue emphasising the importance of attending to sustainable procurement. These are issues not just for greenhouse gas emission, but for other environmental damage, for example, for disposal of single-use plastic. So there's a number of issues there. Another issue that I do want to emphasise that it's not just about health systems. Healthcare sector can do a lot, but in addition, there are very large opportunities to reduce greenhouse gas emissions by reducing the demand on acute care and other care facilities, essentially by reducing patient emissions. And that, of course, involves action in the community to improve population health by employing the various policy measures to support sustainable, healthy choices. And that requires, of course, engaging with policymakers at the national and EU levels. It is the case that in the EU, a lot of health policy, of course, is devolved to the member states, but the European Commission does have greater ambition for health, and there is a lot that we identify that at the EU level can help to decarbonise the health sector in terms of policy support for hospital buildings. Renovation wave has just been started by the EU, by action on diet for hospitals and elsewhere, by attention to policy for air pollution, we heard earlier this morning, urban planning, promotion of physical activity, and so on, but also to support the development of new models of healthcare, for example, digital health, and the current EU pharmaceutical strategy. All of this requires working across sectors. It's not just an issue for the health sector, but of course the health sector can greatly influence what happens in other sectors. Okay, so sorry, next slide, last slide. Okay, so just very briefly on the next steps. As I say, we published our commentary shown here, and both these publications are on our ESAC and FEAM websites. So we published our commentary last month. We're currently working actively to follow up with policymakers in Europe, but we're also using our work to help others stimulate global discussion. For example, the US Academies of Medicine have their own project on decarbonisation of the health sector in the US, and of course, many different issues there. We've also proposed a workshop for COP26 under the UK presidency. So we're trying to raise the visibility and of course, the issues for leadership by the health sector in decarbonising its own sector is a core part of the leadership role for health professionals that we've discussed earlier this morning. And finally, from a perspective of the Academies of Science and Medicine and their European and other regional networks, we think we are well placed to stimulate and integrate discussion at the national level. Nearly all countries have national academies of science and medicine, but also at regional level. And you've heard, I've shown the regional activity in Europe here, and at global level, where there are equivalent regional academy networks that we can stimulate and involve in taking forward these issues globally. So I'll stop there. Thank you very much for your time.